Well, yeah, I mean, I think it's important right now as we are in the period of time as we're entering into the cooler seasons of the fall and the colder season of the winter that we are in a very precarious situation in the United States where the baseline of our infections are around 40,000 new infections per day, which is really unacceptably high. In addition, if you look at a heat map of the states in the United States, there are several states and regions that are having upticks in what we call test positivity, which means that the percentage of tests that you take are positive, which is a good prognosticator of whether you're going to have a surge of infection. And so when you see that, that indicates that there will be increased infections and hospitalizations, which means we're at a critical time right now. We've got to double down on the prevention methods. I'm not talking about shutting the country down at all. We're not talking about locking down. We're talking about implementing some of the important and yet simple public health measures: universal wearing of masks, avoiding close contact, namely physical separation, avoiding crowds in congregate settings, doing things outdoors more than indoors, and hand washing frequently. Those seem very simplistic, but historically we know they can prevent surges and turn things around. So superimposed upon those public health measures, we're making very good progress in the development of vaccines and therapeutics, so that hopefully by the time we get to the end of this calendar year, we'll start to see that we have vaccines that have been shown to be safe and effective that we could start implementing at the end of 2020, the beginning of 2021. So there's sobering news about how the pandemic is going, but exciting, encouraging news about the development of interventions, including vaccines and therapeutics.